Hello everyone, I am myself Dr. Rajesh Gubba. I am the general medicine educator. In this session, I will be discussing a very important topic in the cardiology, that is the mitral valve prolapse. So what exactly is the definition of the mitral valve prolapse? So in the cardiac cycle, when the left ventricle is undergoing systole, the mitral valve closes. That is what should happen normally. But here in patients with mitral valve prolapse, during late systole, during the late systole, the mitral valve leaflets, they cove back into the left atrium. So you can observe that here. During the late systole, the mitral valves they cove back into left atrium. That is what will happen in patients with mitral valve prolapse. So the image whatever is there, it shows you the leaflets lying behind the imaginary line. See, this is the imaginary line. So the leaflets are present behind the imaginary line, and this imaginary line, it is drawn between the posterior aortic root, You can see that this is the posterior aortic root and the atrioventricular groove. Okay, so that is what is your mitral valve prolapse. And in these patients with the mitral valve prolapse, because the leaflets are going back into the left atrium, an orifice is created between the two mitral valve leaflets. Thereby, the blood from the left ventricle will regurgitate back into the left atrium. So that will result in the development of mitral regurgitation as well. See, one of the etiology for causing mitral regurgitation is the mitral valve prolapse. Now you see the various terminologies used for the mitral valve prolapse, or in which group of individuals the mitral valve prolapse is very common. So in individuals with degenerative mitral valve disease, the significance of mild mitral valve prolapse, also commonly referred to as degenerative mitral valve disease, has been in dispute because of the frequency with which it is diagnosed by echocardiography in even healthy young women. So degenerative mitral valve disease, So you will see that in patients with floppy or myxomatous mitral valve, floppy or myxomatous mitral valve. So in individuals with floppy or myxomatous mitral valve, they progress to the degenerative mitral valve disease and they develop this mitral valve prolapse. And this mitral valve prolapse, it is very common in healthy young women. It is common in healthy young women. It is seen up to 10% of individuals. Okay. And which cusp of the mitral valve will undergo mitral valve prolapses? It is often only one cusp of the mitral valve will undergo mitral valve prolapse, and most commonly the middle cusp of the posterior mitral leaflet. Okay, so mostly middle cusp of mostly the middle cusp of the posterior mitral leaflet, they undergo the prolapse, resulting in the mitral valve prolapse. Resulting in mitral valve prolapse. So we have another terminology called as the Barlow's syndrome. Now, when do we use the word Barlow's syndrome? What did I just discuss? Most commonly, it is the middle cusp of the posterior mitral leaflet will undergo prolapse. But when multiple cusps of both the leaflets, if they prolapse, then we call it as Barlow's syndrome. Okay. So what is Barlow's syndrome? When multiple cusps of when multiple cusps of both leaflets, if they prolapse into left atrium, if they prolapse into the left atrium, then we call that as the Barlow's syndrome. And this particular Barlow's syndrome, it is also called billowing mitral valve. It is called as billowing mitral valve, or it is also called floppy valve syndrome. It is also called floppy valve syndrome. And this mitral valve prolapse, it is inherited in the familial cases, In familial cases, it is inherited. And what is the mode of inheritance in the familial cases? That is autosomal dominant type of inheritance, Autosomal dominant type of inheritance. Then, if you take the etiology of the mitral valve prolapse, most common cause for mitral valve prolapse, it is idiopathic, We don't know, We don't know what exactly is the cause for mitral valve prolapse. And the other associated conditions or other etiologies which can cause mitral valve prolapse is, it can be seen in individuals with systemic collagen abnormalities. In individuals with systemic collagen abnormality. And what are those systemic collagen abnormalities associated with the development of mitral valve prolapse? That includes the Marfan syndrome, and second, Ehlers-Danlos syndrome. So these patients, these etiologies can contribute to the development of the mitral valve prolapse. And in these conditions, not only the mitral valve abnormality, there can be coexistent dilated aortic root. There can be coexistent dilated aortic root, resulting in the aortic regurgitation, Resulting in the aortic regurgitation. Okay. Now, these are the etiologies for the development of mitral valve prolapse. And few more features of mitral valve prolapse, if you observe, it is most common in young women, of age group around 15 years, even up to 50 years. Whereas, if the mitral valve prolapse, if it is seen in older individuals, mitral valve prolapse can also be seen in individuals, mitral valve prolapse may be also seen in older individuals of more than 50 years. When it is seen in older individuals, most patients, they are males. Most patients, they are males. Okay. And these patients with mitral valve prolapse in older individuals, they require surgical treatment. They require surgical treatment. Okay. So this is about the basic introduction to your mitral valve prolapse. Now let me discuss what will be the clinical features in these individuals with the mitral valve prolapse. True regarding mitral valve prolapse syndrome is all except more common in females. Most of these patients are symptomatic. High incidence of arrhythmias, transient cerebral ischemia can occur. Okay. Let me tell you, most of these patients with mitral valve prolapse, they are asymptomatic. They are asymptomatic. Most of them, they are asymptomatic. But in few group of individuals who develop the symptoms, these particular symptoms include the palpitations. So what will be the most common symptom? If the individual is symptomatic, that will be the palpitations. Now, what will be the source of palpitations? That is usually due to ventricular premature beat. Right, that is usually due to ventricular premature beat. That will be responsible for the development of the palpitations. Now, why does this ventricular premature beat occurs? Let me explain you. See, in patients with mitral valve prolapse, what is happening? The mitral valve, when it is prolapsing into the left atrium, the chordae tendineae is being stretched. Right, when the mitral valve, when it is prolapsing into the left atrium, the chordae tendineae is being stretched. And the stretch of the chordae tendineae, it is exerted onto the papillary muscles. And papillary muscles will exert the force on the endocardium. Right, papillary muscles will exert the force on the endocardium. And endocardium is also slightly pulled upwards. That means endocardium is being stimulated. And that endocardial pull will give a ventricular premature beat, and that will be responsible for the development of the arrhythmias and palpitations. And the next important complaint is chest pain, right? So this is also one of the frequent complaint, but it is an atypical chest pain. Okay, so it is atypical in most patients without coexisting ischemic heart disease. And it rarely resembles the classical angina pectoris. And what exactly is the etiology of the chest pain is uncertain. But it is the one which occurs without coexisting ischemic heart disease. Now, these individuals, they also have dyspnea and fatigue. So, the frequent symptoms in mitral valve prolapse, including many without... Now, okay, you need to understand why there is dyspnea. Dyspnea and fatigue will be there when the mitral valve prolapse is associated with severe mitral regurgitation. Right, when MVP is associated with severe mitral regurgitation, in those individuals there is development of dyspnea and as well as fatigue. Now, why is that there is dyspnea in patients with mitral regurgitation? At one point of time they develop left ventricular failure resulting in the pulmonary edema causing the dyspnea. Okay. And why there will be fatigue? Because of decrease in cardiac output whenever the individual develops mitral regurgitation. Now, these individuals, they also have the neuropsychiatric complaints, right? And what are these neuropsychiatric complaints? And some of them, they have panic attacks, right? Some of them, they have panic attacks, and some of them, they have frank manic depressive symptoms. Right, and next there can be development of transient ischemic attacks, and there will be also development of stroke. Okay, so these are the neuropsychiatric complaints that you will have in patients with mitral valve prolapse. Next, on examination, the very important part in mitral valve prolapse is the auscultation. See, the principal auscultatory feature of this syndrome is the presence of a mid-systolic click and a late systolic murmur. Okay, so the principal auscultatory finding is a mid-systolic click with late systolic murmur. That will be the principal auscultatory finding. Okay, and it is not a ejection click. Ejection click, you will have that in aortic stenosis and pulmonary stenosis. Here it is the click due to sudden tensing of the chordae tendineae. Actually, I'll explain you about the click. Now, why does the click occurs? Whenever the mitral valve is prolapsing, the chordae tendineae is being pulled. So the chordae tendineae, they are maximally tensed, right? They are maximally stretched. And this prolapsing leaflets, once they stretch the chordae tendineae to the maximal extent, there will be a sudden stoppage of this particular exertion, right? There will be sudden stoppage of this excursion, that is further movement of the chordae tendineae does not occur beyond certain limit. Okay, so that will give rise to a click, right? And that will give rise to a systolic click. And these particular systolic clicks in mitral valve prolapse, they are multiple systolic clicks that you will see in patients with mitral valve prolapse. Okay, and they also have the late systolic murmur. And why is that? That is because of the regurgitation of the blood from the left ventricle to the left atrium. Now, dynamic auscultation is very important. See, the mid-systolic click with late systolic murmur, it gets changed with certain maneuvers, right? It gets changed with certain maneuvers. Let me explain you that. So, any maneuver which will increase the venous return, the click is delayed and murmur is shortened. And any maneuver which will decrease the venous return, the click, it will be early and murmur is prolonged. That is what is the dynamic auscultation in mitral valve prolapse. So, if you see here, maneuvers that increase the venous return. What are those maneuvers which will increase the venous return? Like squatting and as well as the isometric hand grip. So, in these maneuvers, what will happen to the click? The click will be delayed. And what will happen to the murmur? The murmur is shortened. That is what will happen in case of the mitral valve prolapse once if you do any maneuver which will increase the venous return. And you take any maneuver that will decrease the venous return, right? What are those maneuvers which will decrease the venous return? Like standing position from supine or like Valsalva maneuver. In these maneuvers, the venous return is reduced. So when venous return is reduced, what will happen to the click? The click, it occurs early. So you can observe that the click, it occurs early and murmur, it is prolonged. Right, murmur, it is prolonged. That is what is the dynamic auscultation in mitral valve prolapse. So maneuvers that will increase venous return, the click is delayed and murmur is shortened. Maneuvers that will decrease the venous return, the click is early and murmur is prolonged. Okay. Now, what are the complications that you can see in patients with mitral valve prolapse? These complications include mitral regurgitation. Then these individuals, they are more prone for the development of arrhythmias, that is ventricular premature contractures will progress to the development of the ventricular tachycardia and ventricular fibrillation. And these individuals can also have the development of sudden cardiac death. They also develop TIA, transient ischemic attack. And there is also development of infective endocarditis. Okay, so these are the complications in patients with the mitral valve prolapse. Now, if you take the investigations in these individuals, the diagnosis is primarily clinical and confirmed by echocardiography. Right, it is confirmed by echocardiography. So, this mitral valve prolapse, let me tell you, it is often associated with the aortic root disease. Right, it is often associated with aortic root disease. Okay, and this aortic root disease will be in the form of the dilated aorta. And certain patients of mitral valve prolapse, they have associated atrial septal defect. Okay, so you need to look for the other associated abnormalities in patients with the mitral valve prolapse. Okay, then what will be the treatment in these individuals? See, what is the most common symptom, if at all, if the individual is symptomatic? That is palpitations. And why is this palpitations? That is mainly because of your ventricular premature contractures. So, the drug of choice for mitral valve prolapse will be beta blockers. Right, beta blockers. So, beta blockers in low doses are used to treat the hyperadrenergic state when present and are usually satisfactory for the treatment of arrhythmias. So, they will reduce the palpitations. Right, they will reduce these palpitations. Then, Apart from that, the other group of drugs are SSRIs, that is selective serotonin reuptake inhibitors, have also been used especially if orthostatic hypotension or anxiety is associated with mitral valve prolapse. So these are given if there is anxiety in patients with mitral valve prolapse, and some patients have associated postural orthostatic tachycardia syndrome as well. Okay, so this is about the treatment in patients with mitral valve prolapse, and particularly if mitral valve prolapse is associated with the mitral regurgitation, then in this scenario you need to give the drugs which will reduce the afterload. Right, you need to give the drugs which will reduce the afterload. Okay, so that is what is the treatment for mitral valve prolapse. Then what is the indication for the surgical treatment? Mitral valve repair is strongly favored over the valve replacement in many of the scenarios of mitral valve prolapse. Okay, so mitral valve repair, this is preferred over mitral valve replacement. Right, this is preferred over the mitral valve replacement. Now, what does this mitral valve repair include? Mitral valve repair may include shortening of chordae tendineae, right. Number 2, chordae tendineae transfer, right, the chordae tendineae transfers. Next, wedge resection of redundant valve tissue, right, wedge resection of redundant valve tissue. Next, the insertion of mitral annular ring to reduce the annular size. Right, insertion of mitral annular ring to reduce the annular size. So this is what is your mitral valve repair, right? And we also have certain techniques, that is, so how can we repair this? What is the procedure? And the name of this procedure is Alfieri procedure. This itself can be asked as a multiple choice question, that is Alfieri procedure. So in this, what is that we do? Stitching the middle of the leaflets together, right, stitching the middle of the leaflets together to create the double orifice mitral valve is also used at times. Okay, so stitching the middle of the leaflets together, right, stitching the middle of the leaflets together to create double orifice mitral valve. Right, to create a double orifice mitral valve is also used at times, right, and that is what is called the Alfieri procedure, right, or it can be performed percutaneously also. Right, or it can be performed percutaneously also, and that we call it as the mitral clip. Right, that we call it as the mitral clip. And this mitral repair or replacement can usually be achieved through a right mini thoracotomy with or without the use of the robotic device. So that is about the surgical treatment. So mitral valve repair is important. One, the procedure is the Alfieri procedure, and the other, it can be done percutaneously via mitral clip. Now, what about the endocarditis prophylaxis? Because one of the complications we have discussed is the development of infective endocarditis, right? Endocarditis prophylaxis is not recommended for most patients with mitral valve prolapse, regardless of the mitral regurgitation. Okay, so endocarditis prophylaxis, it is not recommended. Okay, and this is about the treatment of the mitral valve prolapse. Then if you see the synopsis of mitral valve prolapse, that is essentials of the diagnosis. Single or multiple mid-systolic clicks often heard on auscultation. It's one of the very important point of mitral valve prolapse. Murmur may be pansystolic or only late systolic murmur, and often associated skeletal changes can be straight back, pectus excavatum and scoliosis, or hyperflexibility of the joints. Why? Because these individuals, the etiology could be either Ehlers-Danlos syndrome or the Marfan syndrome. An echocardiography is confirmatory with prolapse of the mitral leaflets in systole into the left atrium. Chest pain and palpitations are common symptoms in young adults. And let me wind up this session by showing you one important question. Which of the following is true about mitral valve prolapse? Displacement of one or both mitral valve leaflets posteriorly into left atrium during systole. Migration of systolic click and systolic murmur towards S1 during squatting. Prophylactic beta blockers. Restriction of vigorous exercise to mitigate the risk of sudden cardiac death. So, the true statement is displacement of one or both mitral valve leaflets posteriorly into left atrium during systole, that is what is your mitral valve prolapse. And migration of the systolic click and systolic murmur towards S1 during squatting. Actually, during squatting, what will happen to the venous return? The venous return, it decreases. So, what is that we have discussed? When any maneuver which will decrease the venous return, the click will be early and murmur is prolonged. So, if you observe here, with squatting, what will happen to venous return? The venous return increases, right? So, what will happen to the click and as well as the murmur? It is not towards S1. So, the click and as well as murmur, it is away from S1. And the other important point about the prophylactic beta blockers. Prophylactic beta blockers are not given. Only when the individual develops palpitations, that is the point when we give beta blockers. And restriction of vigorous exercise to mitigate the risk of sudden cardiac death, that is also a wrong statement. So, which of the following is true about mitral valve prolapse? Displacement of one or both mitral valve leaflets posteriorly into left atrium during systole is what is called as the mitral valve prolapse. Okay. So, with this, I'll wind up this very important session on the mitral valve prolapse. Thank you very much.